Do you know how many treatments you've done, roughly?
I've done about 400 treatments.
400
Yeah.
treatments. Sounds like you're really setting the trends.
Yeah.
10 questions for you.
Have you memorised these?
No.
Oh,
So
I was
I'm
going to say, I was really impressed then. What was the question? Ooh. That picture is on my computer, open at all times. Oh, it's all loose.
Coffee fueled clinic days or margarita fueled business planning.
Margarita.
Welcome to the NeoGen podcast. Here we dive into the world of aesthetics and we hear from an aesthetics expert about their personal and their professional stories. I'm Simon Jones. I'm president of Energist, who manufacture the NeoGen. We work in Swansea. And I'm joined today by Joolia from the clinic in Norwich. Joolia, welcome.
Thank you so much for having me.
It's brilliant to have you here. Are you
Excellent.
excited?
Very excited.
Me too. This is a kind of new thing for me, so let's give it a go. Yeah.
Exactly.
Great. So you took your ownership of your device last year,
Yeah, last year in July.
and how's it going?
Really, really well, amazingly. So I've been doing this for just over 10 years anyway. So I've got quite a lot of patient group who are really interested in sort of skin rejuvenation, and I haven't got another device. So for me, it was my first sort of real investment into having a device, and I wanted something that would just kind of do everything. And I think that's what NeoGen does for me, but also it's really safe. So unlike lasers, I'm led to believe, I wasn't going to have to worry too much about going up close to the eye and wearing like ocular shields and masks for the staff and that kind of stuff. So for me, safety was a big thing as well. And I think I can sell it quite nicely to the patients because especially when people want around their eyes done, which is a really important area, that, I can say, I can do your eyelids, I can come right up to the lash line. It's very, very safe because people are a bit nervous when you're treating the eyes. So for me, that was a really big tie, because a lot of my patients have got concerns with their eyes. I think that's the first sign of aging for everybody, male and female. So for me, it was really, really easy just to sell it. So
Brilliant. I think you hit the nail on the head there with the fact that NeoGen is particularly strong for treatment around the eyes, which, as you say, it's one of those areas that everybody cares of. So I jumped straight in to ask about how NeoGen's going.
I know, and I went, well, ooh. but we're excited about it, aren't we?
We are, and I need to get started with a question which is prominent throughout this interview. So let me backtrack a little bit and let's talk a little bit about your clinic then. Mm-hmm. So you're based in Norwich, Yeah. You're a nurse.
I'm a nurse prescriber, yeah.
And your background, can you tell me a little bit about your background before?
Yeah, so started off in the NHS and worked in basically started working in a dementia unit. Went on to oncology, but that's all a bit sort of heart-wrenching and very sad. And so I moved into sort of the surgical area, which I absolutely loved. So I was NHS to start with, and then I went into a private hospital where I was a site practitioner and a lead nurse there. So I was looking after lots of different patients. We had sort of 50 consultants, 200 different types of operations. So looking after a team of patients and also managing the other nurses as well. So really, really busy, and I loved that. But it took its toll on my face, so, I had to start having treatments, and that's what led me into this world of aesthetics. I was like,
I don't see how it has taken effect on your face, to be honest. But just with regards to your the surgeons that you were supporting, or the surgical, what type of surgery were we talking about?
Well, I was a plastic surgery link nurse, but I specialised really in wound care, so that was my bag. I really liked doing that kind of thing. But so we just saw everything there, really. Pain control, pain management was a big thing for me as well. So I was very good at sort of a specialist in pain management post-surgically. So, just getting patients from being so uncomfortable when you pick them up at the beginning of the shift to really turning them around and making, they're sitting up in bed, they're eating, whereas, you get there on the beginning of the shift and they're, climbing the walls with pain. So to be able to do something like that and manage their conditions, that was really rewarding for sure.
Very interesting, and we're going to come back to this link to surgery a little bit later, I feel. So in terms of what does your clinic stand for when it comes to, what you offer your customers?
Well, Actually, where it's situated is really, really beautiful. So it's in a really nice part of Norwich, and I grew up in Norwich, and I actually grew up not far away from where the clinic is, which is quite ironic. So we can see the cathedral spire from our window. We're in a listed Georgian building, so it's so beautiful. We've got 15th century windows in there, so when the light comes through the clinic, it's just really beautiful. It's got a really nice vibe. So it's luxury, you know, but it's very, very warm and welcoming. We want patients to be able to come in, feel like they can sit and have a coffee, speak to the receptionist, see all the other devices that we've got. We have got some other devices. We've got a hyperbaric oxygen unit. We've got a Supramax chair, which is for pelvic floor health. So we've got other things that can bring people into the clinic. And NeoGen is in our first room as you come through the door, and everyone sees it when they walk in. They go, "Oh, what's that?
What's that? Yeah.
What's that?"
Is the first door the busiest door of your clinic?
The first door is a very, very busy door.
Yeah, okay, that's good. That's good to hear. That's very good
But
to hear.
no, we just want to have like a supportive environment. And I think for me, with building my own team, that's been amazing because I don't know, sometimes wherever you work, there's always a few people who just, they're not the same people. They're not your people, are they? So what's been really nice is I've been able to sort of cherry pick all these amazing people to come and work with me. And I just love going to work now. And there's not one moment where I don't think don't want to be there. So I'm blessed.
Yeah, that is blessed. Very lucky. That's nice. That's a nice, lovely place to be.
Yeah.
So that's very nice to hear. So you've had the NeoGen. We started off with this conversation for what, nearly coming up to a year shortly. Then,
Yeah. In the summer it'll be a year. Yeah.
And you know, I've heard some really good stories. But should we go back? Did you have an open day at the beginning?
We did have an open day. We had an open day in September because we wanted to just make sure everything was working really well. So that was good. We had the NeoGen was functioning, and one of your staff came and helped us with that as well. So that was really good. We had a big social media input as well from our own social media team, Quirky Frog. So that was really good.
I heard that. There was a very big effort around the launch of the clinic as a whole, inclusive of NeoGen.
Exactly.
So congratulations on having such a successful launch.
Thank you.
So I was thinking, in terms of you've already mentioned that NeoGen is a busy part. Do you use it yourself?
I have had a treatment. I've had about 5 treatments.
5 already?
Yeah. On various different energies. Yeah. But at the moment, my favourite energy is 0.5, which is the lowest energy on the medium setting. And what that does is it gives you a really nice glow, but you have no downtime. And then you can use it for transdermal drug delivery or plasmaporation, which means you can add anything topical, stem cells or growth factors, exosomes, and you can apply it to the skin, and it's super absorbent. And then you just you have it as that vehicle delivery system, really. So for me, when I've been busy, all these events in London, I can't really have the time to have the downtime, which you can have if you have a higher level. So that's been really good. Next Wednesday, I'm going to have a higher level. So I will.
What are you going to go for?
I'm going to go on a 1, I think.
1, okay.
Yeah.
That's going to be absolutely comfortable. You might have a little bit of numbing cream.
Yeah. I will have a lot of numbing cream because I am a baby.
Yeah.
But that's okay.
And once you've applied, what are you going to apply afterwards?
Probably the purisomes.
Okay.
Yeah.
Nice.
The exosomes. Yeah.
Very nice. And so you're probably talking a little bit of heat that evening. We'll feel a little bit of heat, a bit of tightness the next day. But the recovery, what do you think of the recovery?
It's really quick, actually. And I have documented it in photographs for my patients. So, read on the day of treatment, obviously only use the products that I provide. And then the next day you can use makeup to cover up any redness, residual redness. But actually it's almost gone in 24 hours anyway. And then I explain to my patients, your skin will get drier and drier and drier, and you'll look about 100 years old, and then you won't thank me at all. And and then your skin gradually will sort of start to slough off, not a peel as such, but it sloughs away, and then the new skin is underneath, and then we start the whole process again the next month.
Yeah, you described it really well. For those people who are learning about NeoGen, it has the following changes to the skin. So you get, as you say, the sloughing effect, which I call the resurfacing effect, which is about the skin that has been exposed to the high temperatures.
Yeah.
Only in milliseconds. That's the magic of NeoGen, that we're applying high heat in milliseconds. So that causes those tissues to be desiccated. They remain intact, but they come off 1 or 2 days, 3 days later, depending on how deep we've gone. And that's the kind of resurfacing effect. Really clears up the texture. It's helping it's reducing the pigmentation in your skin.
The pore sizes, that's what I'm noticing a difference with.
Yeah,
Definitely.
so you're getting to see the closure of pore sizes.
That's the first thing we're noticing. After about 3 treatments, that's really noticeable on the photographs.
Wonderful. And, that's a testament to actually we're getting energy into the papillary and potentially on medium energy, we're putting more into the reticular dermis, because we get the regeneration effect in the dermis. We're resurfacing some of the epidermis and we're regenerating dermis. So we get a beautiful effect of clearing up the pigmentation, clearing up the pores. Then we get modification that changes the collagen levels, the elastin levels, and we get the improvement of fine lines and wrinkles and all of those other lovely things. You get so many benefits from a single.
And I think we get all that without even breaking the skin, don't we? And that's what's so nice about it as well. There's no scabbing, is there?
There's not.
Not at the lower levels anyway.
No, there's no. Even when you take up the energy to something very high, there's no blood, there's no oozing, there's no puncturing, there's no vaporization. That skin remains completely intact. It's a natural biological barrier. Yeah. And that actually speeds up it accelerates the healing as well. So really is tailorable for, somebody like yourself who wants to have a glow that doesn't want the downtime. Yeah. And then you'll have other customers who have significant pigmentation, sun damage, or significant wrinkles. And they can either get to that by a series of low energy, or they can go for one bigger, higher energy. Yeah.
So I've done a few high energy treatments, and actually I've found that we're still in that process of waiting really for the results. So I think we might do a couple of lower energy treatments, but I think for this first year for me, it's a really educational time with the machine. I'm playing around with, different energies and different frequency of treatment as well. So it's a learning curve, I think, that first year, and we're all excited, but actually I've got a few models that are doing some different things. We're doing some body work as well. So I'm working on arms. We've done some abdomen. We've done some knees as well. So, really looking forward to getting those results through. But I've found when treating the body, I think you'll need more treatments. Longer, and I think much higher energy. You can take a much higher energy on the body for sure.
Yeah. How about the neck? Have you treated the neck?
Neck and décolletage loads. Yeah.
And good results?
Yeah, very good. Yeah.
Okay, great. So
the neck's really difficult to treat, to be honest. You need to hit it with 2 things, really. You do need to restore some volume there as well. So I think, if you're using it with other treatments, so for example, the hypodilute Radi-S, which has got the license now, or polynucleotides or skin boosters to a certain extent, but sometimes you do just need to restore some volume, especially for older ladies, and then you can rely on the NeoGen to sort of tighten the skin as well. So sometimes 2 treatments is good. Yeah, I've found.
Have you ever, I guess as part of your consultation process, have you ever had to turn anybody away?
Not yet. Why would I have to turn anyone away?
Well, no, I think I'm trying to demonstrate the point that it really...
In terms of skin type, no. I have 2 lupus patients who have proceeded, and we're on a low treatment with them. But obviously they know that if they get lupus, patients get a butterfly rash on their face. So their lupus is controlled, and they know that if they, have that lupus crisis, then they obviously know to let me know. But it's almost like sometimes you have a contraindication for treatment, but you have to oversee that and look past that sometimes, because it's always not black and white. So I think if you can keep them on a low energy and they understand that and they're happy to go with that, then actually that's been safe, and they've had 2 treatments each with no issues.
Brilliant.
So,
and I think it's a really good policy that you're adapting there or adopting there is cautionary. Yeah. And then, once you've got a little bit of confidence in terms of... The
patients are excited. They want to try it. They, they've got an issue with their skin. They want to see if they can get improvements. And I think sometimes a blanket no is a shame for some people.
Yeah, it was a slightly loaded question because it is a more friendly, let's say, user a more friendly technology. So because it's thermal energy, it can be used on darker skin types.
Yes.
Because we're not, because it thickens the skin, we can use it even on sensitive skin.
Yeah.
We can use it on older people. We can use it on different body parts as you're doing. So, yeah, I was just trying to work out whether you were having to turn.
We're getting a lot of men coming through, though.
Are you?
A lot of men. They're really interested in it. They're really open to it. And it's not really something I'd seen that much in clinics before. But I think men are just taking so much more care of themselves. They want, and actually, I think especially the draw to the eye treatments. For men, it seems to be the eyes where they start to get, 45, 50, they start to feel tired, and actually the rest of their face is still holding up.
Yeah.
And you all have the luxury of putting a little beard on there as well, which hides the jowls, unlike us girls.
Yeah.
So they're coming in for the eye treatments, and that's really nice for them.
I think when you talk about jowls, the one that keeps coming to my mind is Shirley Ballas.
I know, what an incredible result.
Yeah.
That picture is on my computer, open at all times.
Yeah, it is incredible in terms of she only had low energy treatments. She did have, 6 when these photos were taken. She's still having treatments.
Yeah.
She doesn't want to give up on the treatments. And it was a transformational change to her jowl, as well as the pigmentation, as well as the whole face. But what I think about your comment about men coming in more often, I think maybe in the future there may be an opportunity for men wanting to have a bit more of a snatched jaw. It's
I have done full face on men, and it is actually okay, because I was a little bit worried about obviously the facial hair, because obviously with the plasma you do lose the sort of vellus hairs. They're taken away, aren't they?
Yeah. So this beard
Yeah.
is thicker because I've had NeoGen treatment,
Oh,
believe it
really?
or not. Yes. So I haven't got any evidence of that, only my own personal opinion.
Yeah.
But no, I've had a number of treatments, and I feel that the hair is stronger and there's more of it following the treatment. I can't say that it's helped my head, because I've also had treatments on the top of my head, and obviously there aren't any kind of
Perhaps
follicles
the
of
hair
that.
exosomes afterwards for transdermal drug delivery.
Yeah, you've mentioned this transdermal drug delivery twice now, and
know.
I can absolutely back you up with regards to how effective it is, because Swansea University in 2023 did an experiment. They treated some skin with NeoGen, and they had some skin which is untreated.
Yeah.
And the treated skin absorbed 8 times as much ascorbic acid, vitamin C, as the untreated skin in the first hour. So we have, scientific proof that NeoGen is increasing the skin permeability immediately after a treatment, and it stays open for 24 hours in terms of that channel.
Yeah.
So combining things is good, as you're already doing with topicals. Can I ask about this hyperbaric?
Hyperbaric oxygen.
Yeah. So can you tell me a little bit about this, please?
Yeah, so it's a chamber that you go into, and you have an hour-long session. And when you have oxygen under pressure, it pushes oxygen into the plasma of the blood. So normally oxygen is carried around on your red blood cells. So we don't have a free amount of oxygen within the blood. However, when you have it within the plasma, it can reach other places where normally oxygen wouldn't be able to reach. So in the NHS, for example, we use hyperbaric oxygen for diabetic patients because they have slow chronic wounds that won't heal. And, obviously you've heard the divers will go in when they've got the bends to help get rid of the nitrogen, the excess nitrogen in the blood. Mm-hmm. So it's really good for reducing inflammation. So it's great for all the sportsmen. We have footballers. We've got a couple of cricketers that come in that have got injuries. They need to get the swelling down, I've got people who do high rocks, which is a competition. And they were doing a high rocks competition out in Spain, and they were coming in and having some pods before. So marathon runners, that kind of thing. It's really good for your skin, your hair, your nails. It's great for a hangover. I'll be in there on Sunday after the awards. And no, it's a really nice treatment to offer. No one has got one of those in Norwich either. And the same with NeoGen. I'm the first in Norfolk to have a NeoGen. So having these things available for people to try that they've never seen before is a really big draw.
Yeah, it sounds like you're really setting the trends.
Yeah.
It's great to hear that the hyperbaric chamber is helping the recovery for NeoGen patients. I think there's going to be a realization that the oxygen hyperbaric is really good to support treatment recovery.
Yeah.
I think it's already proven,
Yeah.
and I think you've once again been very smart with regards to your choices, because I do believe in the future we will see more people using hyperbaric chambers to support recovery of potentially bigger treatments that need that extra kind of lift.
Pre and post surgery. We've had some people for pre and post surgery as well. So ruptured ACL, you've got to get the swelling down before you can operate. So we've had someone, a footballer, that had to come in and have several sessions, and then he was able to have his surgery then. So yeah, it's quite interesting to see.
Yeah. Can I take you back to your surgical, the days in the NHS when you were supporting surgery?
Yeah.
You talked about plastic surgery as well, yeah?
Yeah.
And I don't know where this conversation is going really, so but I'll try and bring it back to how NeoGen is supporting surgeons in preparation.
Well, when I
post,
see
and
patients
instead of.
and they come to see me, the ideal kind of NeoGen patients, I would say, they come and go, oh, it's all this. That's what they do. And I just go, I know, I feel it too. You know, it's all happening, isn't it? But what they do is they just want a lift. But they might not necessarily want to go down that surgical route. But the thing is with NeoGen is if they have a course of treatments and then they still decide to have surgery, they've got their skin in better condition to recover from that surgery anyway. So it's not actually a waste of money. It's not like, oh, I shouldn't have had that. I should have just gone for the surgery.
Sure. And when you say preparing, are you talking about like the thickness? And
Yeah, improving the quality of the skin. The blood supply will be improved as well, won't it?
so that's going to be helpful for them, because when they do decide, if they decide to go under the knife, that the chances of having a complication are greatly reduced. Is that correct?
Exactly. And then after their surgery, you know, I have a lot of ladies that come in, even with sort of very old, you know, facelift scars from years ago, and I'm able to work very closely on those with the NeoGen, and that really helps to improve the quality of those scars after surgery, and also the eyelid for the upper breath. We can just go over those as well, because even though they've had surgery and they might not need to have the eyelids tightened, you still want to keep that skin in good condition, because you've only got, you know, 10 to 15 years after a breath before you need another one.
Right,
or, you know, so if you can keep
forever.
that skin tight, the surgery has had more benefit.
Great point. And so, yeah, you've talked about the help preparation for surgery. You've talked about revising scars post-surgery. And then a couple other things I would mention are Dr. Klitschko. She is using, if there are any fragile areas following surgery, whether it's punctures or where maybe a webbing has caused some kind of fragile skin where it's slightly exposed.
Okay.
Or actually, I've seen photos on multiple occasions now of where there's necrosis skin.
Necrosis, yeah.
Where there's a lack of recovery. And
that's when they need the oxygen therapy as well, you see.
Good plug. This is
NeoGen and oxygen.
this is off label, completely off.
Dream team.
Completely off label.
Yeah.
However, there are doctors using NeoGen to restart necrotic skin at very, very low energy, and they are getting some wonderful results in terms of regenerating those tissues which are struggling to mend themselves.
Yeah.
So there's that kind of regeneration effect. There's also the fact that if, as I was mentioning, if there's a puncture, you can actually coat that area with NeoGen to sterilize it.
Yeah.
So if there are any potential infections in that area, you're killing those off. So there's a lot of preventative measures that come with using NeoGen with surgery, and you've mentioned instead of with the eyes.
Yeah.
And then if somebody does want to have surgery, surgeons are offering them to improve the quality of the skin, have a NeoGen at the same time.
Yeah.
And there's also the fact that you get extra tightening as well. So even though surgery is about tightening, if you add NeoGen into that equation, you get better tightening.
The skin needs to be good quality. Even if you're having surgery and you're having a lift, if your skin's not in good condition, it's not going to be a good result, is it? You know, so your skin still has to be in good condition to take that, you know, stretching and pulling back. If your skin's not in good condition, it's just not going to be as good, is it?
No, you're absolutely right.
Yeah.
So very interesting to hear about your background in surgery for that perspective. Where do you think medical aesthetics is going? Are there any trends you can see, or any what are patients' expectations doing? Are they?
Well, I think they're getting so much more educating, aren't they now? So they know what they want. I think sort of whole body wellness is a big thing. Biohacking, blood testing, nutraceuticals, all that kind of thing. I've just been looking, at that kind of thing, really. We're obviously here at ACE at the moment, looking at the conference. And, all of those kind of supplements, that's a really big and very important part, because internally, if everything's functional and if our gut health is good, then it's going to show on our skin as well. So it's about educating patients. It's not just about injectables, or it's not just about a treatment. It's about making sure they feel good too. So it's wellness and having that perspective. I think that's a really big thing.
Yeah, I would agree that wellness, regeneration are all trending upwards in terms of what consumers are looking for and what practitioners are starting to offer as well. In terms of your clinic, have you achieved a return on investment, or when do you think you'll achieve a return on investment on your
I think I have
NeoGen?
received a return on investment,
You
actually.
have you?
I have, yeah.
That was quick.
I know. I was busy.
So do you know how many treatments you've done, roughly?
I've done about 400 treatments.
You are kidding me.
Yeah.
400 treatments?
Yeah.
That is amazing.
I know.
What would you put that down to?
Great saleswoman.
Okay, in addition to being a great salesperson.
It's easy to sell. It's a good machine. It's a good product. And actually, as a company, I love that it's a UK-based brand. I tell everyone that. That's important to people.
Absolutely.
You get good support. We are really lucky because you've got some really good advertising out there that we can fall back on with, obviously, Shirley and Linda. And people know those women and they trust them. They feel they know them on the telly. My patient group are primarily probably that sort of age. I would say 45 to 65 is my sort of like target group. That's also my age. So people can look at me and go, oh, she looks all right, for her age. And I go, yeah, well, it's the NeoGen. They say, yeah, off you go.
Open that first door in there.
But they're excited because they don't really want filling. Filler is great. I love filler. I've used it for years. It's got its specific place for revolumizing, but actually it shouldn't be used that much. And the same with the anti-wrinkle injections. At the end of the day, it's a toxin. People kind of want to get away from some of these things. I'm not saying that this will supersede that, because I do think there's a place for everything. But I think with NeoGen, I've got ladies that didn't want filler, never wanted filler, but they will have that because they see it as a natural alternative.
Yeah, I agree.
Have you done like some volumetric studies and things before and after treatments?
No, not personally, in terms of understanding exactly. Well, we have. Yes, we have. We have a recent study from Q-Test, which has just landed, and it was a 12-patient study, 3 treatments, and it increased the skin density by 80%, and it also reduced cheek wrinkle by 54%. So yes, we have got.
It's interesting you say that, because that is exactly where I see the improvements first. It's kind of here, isn't it?
Definitely.
I don't know why that is.
Maybe
I'm not using a different energy.
Maybe because there's a bit more tissue to work with there, and the fact that
maybe that tissue's a little bit more hydrated. I'm not sure.
Possibly. But it is definitely working. We also had the lip. The smoker's lips, bar lines or bar curves, whatever they're called.
Perioral lines.
They were improved by over 20%, which I don't think is that
They
easy to achieve.
They're a really difficult area to treat. Yeah. Really difficult.
So this study will be released in the next couple of days, so people can access that on our website. It's all good news then in the clinic.
Yeah. So.
Do you have a vision for where you're taking your clinic?
Well, I'd like to be like Charles Medispa in the USA and have 3 rooms with a NeoGen in each room.
Well, they are very aspirational.
Because obviously the FDA approval as well is a good selling point, I think, isn't it? It's just a trust thing, isn't it?
It is indeed.
I know it's not relevant really to the UK, but I think if anything's gone through FDA approval, it's something that's, of high standard, isn't it?
Mm-hmm. So are you happy with your decision to buy a NeoGen?
Oh, really happy.
Yeah?
Really happy. Yeah.
And how is our support compared to How is the support from Energist compared to?
It's always been really good.
Yeah.
It's always been really good. Yeah, really effective. I get the replacement nozzles really easily. They always come on time. I've never had any issue with anything. So, yeah, so far so good.
Okay. Is there anything you'd like to ask me?
We want to know a bit more about your history.
About my
Yeah,
history?
yeah.
Okay. So I'm an accountant. So that's where I started.
Yeah.
I've been working for Energist. I started as the finance director 10 years ago and then progressed through the commercial activities. And now I find myself the president, which is responsible for sales, marketing and clinical. I guess my transition from being a finance guy to a sales guy,
Yeah.
probably blame that on my dad, that he was a car salesman. And I probably just got that natural
Ability, it's just there, isn't
yeah,
it?
I think it goes without trying.
That's
I
it.
think sales is about relationships, and I guess I could get quite good feedback around how I look after people in terms of relationships and always do the right thing.
Yeah.
And those, relationships get stronger and stronger if you work together. So I guess I kind of found that a natural thing to do. I think what's been a bit more challenging for me is marketing and clinical. So I got a great team with Justin looking after marketing with Jen, and I've got Tyrone looking after clinical with Sarah, and a very, very capable team. So it's just about
Tyrone was great, actually. He did the training for us. And what was actually really nice was that you come back and do that secondary training. Because I think the first training, you're all just so excited. You just want to get on with it and you just want to get going. And then as you start to use the device, you're a bit like, oh, I should have asked about this. I should have asked about that. And so that's where it was really nice when he came back, and then we did some more high energy work as well. And then he went basically through a lot of the same training, but you just pick it up. You pick up different things the second time, don't you? And actually I think that was really important, and that was real benefit for me specifically.
Well, you're absolutely right. We have 2 full-day training sessions. We also have a follow-up. And we've also got Adam, who's going to be contacting you at least once a month to say, how's it going? Yeah. He's in charge of the customer success program.
Yeah.
So this is something that we've developed with the aim of supporting customers be successful. So which could be anything from tips and tricks around marketing, confidence in terms of technique. So there's a plethora of things that we can do to support customers in terms of being successful, led by Adam and Susie and Suki in the UK. So we've got a lot of people who are ready to help in the UK, and I'm glad that you found that supportive. So I think what we'll do is do a quick fire thing right now.
Okay.
So I've got 10 questions for you.
Okay. Have you memorised these?
No.
Oh,
So
I was going to say, I was really impressed then.
Okay, so we've reached that critical point in time now where it's all about fun.
Oh, okay.
And we're going to do some quick choices. So this is putting you under some pressure to answer either A or B
Okay.
based on your
God, I'm
instinct.
so
Okay.
indecisive, though.
Well, let's see.
But
You've
I'm
got
greedy.
to answer quickly.
I'm greedy.
Okay.
I want both things.
To do this, you've got to do it quickly.
Have I? Okay.
All right. NeoGen treatment or chemical peel?
NeoGen treatment.
That was an easy one, wasn't it?
Absolutely.
Yeah. Let's hope they get a bit
Yeah.
tougher. Early morning skincare routine or late night clinical research?
Early morning skincare routine.
Skin health education or hands-on treatments? No, it took too long.
You can't.
No.
It's both, isn't it? I was definitely like, you could hear the cogs turning then, couldn't you?
Yeah.
So, oh no, they're both
Okay.
as important as each other.
You've had some time to think about it. What's
Yeah.
your answer?
What was the question?
Treating first-time no, not that
Another
one.
one.
Skin health education or hands-on treatments?
Skin health education.
Okay. Treating first-time clients or long-time loyal patients?
Long-time loyal patients. It's like treating your friends, isn't it? I love the new people coming through the door, but it's the loyal patients that are the ones that mean
It's
the
about
most.
the relation bit.
Yeah. Yeah.
London aesthetic trends or keeping things bespoke and local?
Bespoke and local, obviously. In Norfolk.
High-tech treatments or classical facial massage?
Oh, high-tech treatments.
Skincare or energy?
Energy.
Coffee-fueled clinic days or margarita-fueled business planning?
Margarita, margarita, margarita.
Great. One powerful treatment or a range of smaller treatments?
One powerful treatment.
There we go. You only
that
paused
it?
on one, really.
Okay, yeah.
Well done. You did very well
Oh,
there.
thank you.
So now we've done all of it,
Awesome.
basically. We've
Thank you for
we've
having
covered a lot
me.
of ground today, haven't we? I'm really, really grateful.
Oh, no problem.
Have you enjoyed it?
I've had a lovely time. Thank you.
Good. Well, things sound as if they're going really, really well for the clinic and
Yes.
yourself in Norwich.
Yeah.
And I'm
Come
really,
and see us and have an oxygen pod.
I'd like to do
Yeah,
that. Yeah,
yeah.
maybe I can be a guinea pig.
Exactly.
You can whack me with NeoGen and then put me
Yeah,
in the chamber.
Exactly.
Sounds a little bit off, but yeah. No, I'm up for that. I'm definitely up for going in your chamber.
And then we'll have a margarita.
Yeah, absolutely. That will help as well, I'm sure. So it's been excellent to talk with you
thank
and
you so
learn,
much.
learn how well you're doing.
And I'll see you out on the stand.
Yeah, and I wish you all the best for the very
thank
future.
you.
Thank you so much. I hope you enjoyed our NeoGen podcast. For those of you who are interested in learning more about NeoGen, if you're a practitioner, please go to our website. It's www.neogenplasma.co.uk. You can find lots of information there about the technology, what it does, the indications, etc., etc. And if you're a consumer and you're interested in having a treatment, a NeoGen treatment, well, please go to the same place. On our website, we have a clinic finder page where you can locate your closest clinic and you can call them up and you can go for a NeoGen treatment, which I strongly recommend you do. So thank you very much for listening. I hope you've enjoyed. See you again soon.